Heart rhythm disorder is any disorder which causes your heart to beat abnormally. By far and away, the most common disorder that we see is a condition called ventricular ectopics. These are extra beats, extra heartbeats, which originate from the bottom of the heart. And we all have ectopics, but some people have more than usual, or some people are particularly symptomatic when they have these beats. And ectopics are often precipitated by alcohol, caffeine, stress, lack of sleep. So simple lifestyle modifications are often all that is needed. But if you're worried, you should consult your cardiologist or electrophysiologist who can offer you more guidance. Other common conditions that we see are conditions called supraventricular tachycardias, or SVTs for short. These are fast, regular rhythms originating from the top of the heart. By and large, they're not dangerous, but because your heart is racing, it can really make patients feel unwell. The unpredictable nature of SVTs mean that they can come on at any time, and often patients may be woken up from their sleep or after a meal develop symptoms of a fast racing heart. Nowadays, SVTs can be treated very safely and effectively by a procedure called an ablation, which involves passing fine wires from the top of the leg into the heart and removing the abnormal trigger. Third condition is a condition called atrial flutter. This is a fast, regular rhythm coming from the top side of the heart, which again is more common in patients with structural heart disease and is easily treated by ablation. Finally, atrial fibrillation is probably one of the most common heart rhythm disorders that we see, and this is an irregular, chaotic heart rhythm which can lead to an irregular pulse, increase your risk of stroke. Treatment options for atrial fibrillation include reducing your risk of stroke by using blood thinners called anticoagulants, medications to control your heart rate and/or rhythm, a cardioversion, which is an electrical shock which sends your heart back to a normal rhythm, and finally an ablation, which involves removing the abnormal triggers for atrial fibrillation with high frequency energy or by freezing.